Okay, later I will post it, so I'll use this to study, okay? Again, this is all your anti-epileptic, right? Topiramate is here, lamotrigine is there, that's the one that pregnant woman. Gabapentin, that's the one that I use for phantom pain, right? Clonazepam, pam 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 pam. It is anxiety, but it is also anti-epileptic. Okay, phenobarbital, valproic acid. Valproic acid is antipsychotic, but it's also anti-epileptic. So it can be two function. It's your Depakote, right? It's your Depakote, it's your anti-schizophrenia for schizophrenia, but it's also for anti-epileptic. Now all cardio medication. The important thing, I mentioned this already earlier, glaucoma, timolo, be careful, olol-olol, so check BP. Okay, I mentioned already propanolol, not for asthma. There is inotrope effect. Your pril also have inotrope effect. So you have to treat your timolol, your olol and pril just like digoxin. Pril, dry hacking cough. That's very common question. And then same thing, calcium channel blocker. Be careful with your congestive heart failure. Okay, calcium channel blocker. If somebody have hypertension, I usually will give them antihypertensive, and I also will give them diuretic so they can pee, so the pressure can go down. So one thing that I have to remind you, uh, sildenafil is the Viagra, right? Sildenafil. Never ever mix together with whatever that BP make BP go down, right? So you certainly will not take nitro because nitro is your vasodilator. Vasodilator. So if you take this nitro plus Viagra, the blood vessel will be all too wide. The BP will go down. And I joking and said they died happy, right? Will be very low, double, low, and gone because they both vasodilator. That's why when you touch nitro, don't touch with your bare hand because if you touch with bare hand, you can have headache, right? So if I give somebody nitro and then they have headache, that's actually normal. Doctor usually will already order Motrin or Tylenol, right? But still, you don't want to touch with your finger, okay? Talking about nitro, your nitro, you do have the one that's sublingual, right? This is for people that heart attack. So if you heart attack, after I check, assess, and ask question, everything, and then after I check vital sign, and it's true, the patient look like point the heart area and look like it's really can be heart attack, can be the MI, right? And in the order, there is nitro order. So I will give them nitro sublingual, right? And sublingual means I want to put under your tongue and let it dissolve slowly under your tongue. So you certainly will not give them drink. But if they have dry mouth, you can give them one sip of water, correct? Let me give you one sip of water first before I put the nitro under your tongue. And then after that, you put the nitro under the tongue. Don't drink and again because it has to be dissolved slowly, not because of water that you drink, right? And why I can take a sip of water before if I have dry mouth, because if you're too dry, it will not absorb the medication too. So only one sip is okay, but not a lot. Okay. And then once I put inside under the tongue, let it dissolve. And then 5 minutes later, if it's still pain, that's when we give number 2, right? But now just call 911. The first time still pain, call 911 already. Even 911 come, the paramedic come, they still will not take the patient if the pain already go away. Because if the pain go away, that's not MI, but it's angina pectoris, right? Only the similar look like heart attack, right? So nitro sublingual, right? And then if 5 minutes later still pain, give number 2. 5 minutes still pain, give number 3. And then nitro also, that's the one that have the nitro pads, and you already see the question in your ATI, right? Every morning change with a new one. But then actually you don't leave it there the whole day, 24 hour, right? You take it out like 10 to 12-hour rest, and then tomorrow you apply the new one. And make sure when you apply the new one, you sign and date, initial your name, right? And then if you see something old, you have to clean it up first. Use your glove, of course. And then be careful with that medication. You have to fold it nicely and throw it nicely, right? You don't want anybody sit on it and then dizzy, right?
Miss Ina,
Yeah,
so for the nitro patch, you only use it for 12 hours?
yeah,
Okay, thank you.
yeah. So you just let it rest, and then tomorrow you apply the new one. Don't apply at the same area because then skin integrity.
And then can you apply maybe later in the day, in the afternoon, instead of
No,
the morning?
no, you want always the same time.
Oh, okay.
Yeah. There is certain thing that you have to do always the same time to get the good result. Example, when you wait the patient, you need to wait at the same time, the same equipment, the same way, right? The same type of gown. Don't use your shoe, and make sure they already pee, so you will get the best accurate number.
Christine, I have a question. Isn't it wear the patch for 10 hours and let it rest for 12 to 14?
That's what I say.
Oh, okay. Because I thought she said let it wear it for 12 hours. And you said, yeah.
You said wear 10
10
to
to
12.
12 hours. 10 to 12.
And then let it rest for 12 to 14, right?
10 to 12, around that number.
Okay.
Okay. So for the medication that related to HEMA, so be careful, this is all can cause bleeding. Okay. Anticoagulant, your blood become very thin. Usually for HEMA problem, I also give them anti-lipid. This is anti-cholesterol, anti-platelet, bleeding, thrombolytic, lysis, the thrombus. This is the one that I have to ask, what time is your heart attack? What time is your stroke, right? Anti-anemic. This is the one that I give epogen to make more RBC, right? Be careful with hypertension, hyper, not hypo, and drug to treat bleeding. Okay, your amicar. Amicar is the your antidote when they bleeding, bleeding, bleeding. So drug to treat bleeding. So this under your hematologic drug.
Miss Ina, sorry, I have a question about the heparin. So for the heparin,
I'm
do we
not yet there. Just wait. I will be there soon. Okay. For thrombolytic, memorize your kinase. TPA. Make sure you memorize the name. At least 3. Streptokinase, urokinase, TPA, you have to know. That's your thrombolytic, right? And this is the one that when is the heart attack, when is the stroke, because it's very good if it's new. So I want the one that fresh MI 3 hours ago. It will give the best result. Because if your heart attack or your stroke yesterday or 2 days ago, the clot is already too hard, so this medication not really working. Maybe they need an arterectomy, right? They need surgery and take the clot out. And this is the one, if I give you too much and then you will bleeding a lot, so my antidote is amicar. Yeah, a lot of memorize for farm, memorize. Uh it's not many understanding. So this one is not about rational. This one is about memorize.
And Messina, and these are the ones that are actually used to dissolve the clots, right?
Yeah, lysis the thrombus.
Okay.
So if you know your wording, it's very helpful. Sometimes it's very sad to see students don't know your terminology. This is totally a friend, a blessing for you. I lysis your thrombus. That's why there is one NCLEX question, right? Very common, and student always got this question. Thromboangitis obliterans. Have you ever hear this name or no? Who remember what is thromboangitis obliterans? Where you hear this before? Term 3, methods. Do you hear this before about this?
Is it something like
Like
Go
what?
ahead, Raf.
Is it something like a blood clot in the heart? But then I don't know what the obliterans is.
Sounds like thromboinflammation, itis inflammation.
Have you heard burger disease?
Oh yeah.
Mhm.
Okay, so you should already hear this. And then similar like this is the one that Raynaud. And Raynaud disease and burger disease, they complain the same. My nose is cold, my finger is cold, my ear is cold, everything that peripheral, cold, 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 cold. Guarantee no smoking because smoking is vasoconstrict. Vasoconstrict. Usually when I see this question, it's always asking about no smoking. Okay. So look, if you know your terminology, actually it's a blessing because let me show you, right? How it blessing. Uh, oh, no wonder this way. Thrombus is your blood clot, thrombus. Angio is your blood vessel. Itis is inflammation. Obliterant means occlusion. So I don't even need to know burger disease. Only from the word, I know that this is something occluded. It's inside the blood vessel. There is inflammation because of the thrombus. Does that make sense? If you know your wording, it becomes so easy, right? Obliterant means occluded. Angio is blood vessel. Itis is inflammation because of the blood clot. So the test question will ask you, I know the sign and symptom is the same, nose, finger, ear, everything cold, but what is the treatment? Who can answer my question? How you treat burger disease and how you treat Raynaud? Is there any different treatment since they both have the same complaint? My nose is cold, my finger is cold,
Can you
no
do a
smoke.
warm compress,
Which one?
like a heat pad,
Which one?
for
Burger or
burger
Raynaud?
disease for burger?
So there is itis, there is inflammation. Can you heal inflammation with something warm?
Yes. It helps with circulation and increased circulation can help with swelling.
Okay, so if you know the wording, then you can get this easy. There is thrombus here, there is blood clot here. So you want to use something that can dissolve the thrombus. Thrombo, thrombolytic. Your anticoagulant, your antiplatelet, something that can deal with the thrombus because there is blood clot here. Okay, so don't forget there is blood clot. So your medication will be something to dissolve the blood clot. And then the one that Raynaud here, it's not thrombus. There is no blood clot in Raynaud. Raynaud because of the vasospasm.
Still working on setting up.
Can you mute yourself, please? We can hear you. Who is that? Okay.
Miguel, you got your mic on.
So Raynaud is vasospasm, and that's why your medication will be muscle relaxant. Okay. I don't even need to memorize something. Just from the word here, I know it's thrombus, so I need something to deal with the thrombus. But Raynaud, I need to know, memorize that it's a spasm in the blood vessel, and that's your artery. Artery have the muscle there, and the muscle spasm, so you need muscle relaxant. Okay, but to prevent both, the answer always about this. So in the test, they always ask you, and they usually asking about this. What is your patient teaching? No smoking. Don't wear something too constrict because your blood vessel problem. There's one test question set. Somebody have Raynaud. A, are you going to teach them no smoking or you need to tell them move away from cold area?
Smoking.
If select all the apply, both correct. But if only one answer, you will choose the one that no smoking. And the
ABC.
and the rationale is it's not appropriate to tell people to move away, right? So this one is called area like area where they have snow, and then it's not a good idea. They live in snow area, and then they shuffling the snow, right? They can have the frostbite here, okay, with the Raynaud. But again, I see that question. If you have to choose between two, your answer still no smoking because it's not appropriate to tell people to move away to the warm area. This one just for you to read and hopefully that helped. But it's TPS, streptokinase, alta place, right? Move on. I want to talk about something. Let me put it here. Cystic fibrosis. I want you to remember this, okay? I hope you can hear my voice. Tick, tick, tick. Mucus everywhere. Okay? Every time you see the word cystic fibrosis, always, I hope you can hear my voice. Tick, 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 tick. Mucus. Cystic fibrosis. And it's everywhere and means it's inside there. Let me make sure you get this. Right? It will be in their respiratory tract. That's why they cannot breathing, they cannot swallow also, right? They cannot breathing. So I need to give them chest percussion therapy. Chest percussion therapy. Of course, empty stomach. Okay, if not, they will choking. Chest percussion therapy, I have to increase fluid because I need to liquefy the mucus, right? So increase fluid because I need to liquefy. Know this word, okay? Liquefy the sputum because the sputum is way too thick. And then I will also give the mucomis humidifier, right? Humidifier, mucomis, expectorates, everything that can make that sputum finally become thin and get out, right? So your mucolytic, mucomis, your mucolytic to lysis the mucus. And after they finally become thin, if I have to put the baby upside down to make the mucus come out, I will do that. Postural drainage. Right? Postural drainage. And this is the one that you stuffy nose at the right side and then you turn like this. So it go down. And then you stuffy the other side. Now you turn around to the other side. That's actually postural drainage. Okay? So in respiratory tract, everything thick. And then they also in the GI. Everything thick, including your bile. Very, very thick. And this bile to emulsify fat, correct? Emulsify fat. So now you're in trouble. This patient in trouble because they have all the bile is so thick. Don't you give them fat diet, okay? Because if you give them fat diet, then they will have steatorrhea, fatty stool. All will gone with the poop and it smell really bad, steatorrhea. And the vitamin that will be problem is vitamin A, D, E, and K, right? Because this is fat soluble. Because every time if they eat fat, they all throw away through the poop. So they lack of ADEC. So you need to help them with vitamin ADEC. And for this reason, that's why I will always sprinkle pancreas enzyme for pancreas, lipase to break down my lipid, protease to break down my protein. Okay. Other name Fiocase. Sometimes they use right. So all these different name, but if ending with ACE, that's your enzyme. And then why you need this? Why you need lipase? So it can break down the fat. So you still can eat a little bit fat, but I help you basically with enzyme to break down that fat. So you will not poop it out. So I can reduce your steatorrhea by giving you enzyme. Okay. So not only in their GI, everything thick, also in their reproductive system. And that's why they cannot have baby. Right? And also for this one, their skin is very salty. So they throw away their salt through their skin. So now your diet, you have to replace the sodium. Don't take away sodium from them because they lost their sodium through their skin. So this patient will need what diet? Low fat, right? You have to give them low fat diet and you have to give them salt. So their diet is salt, don't take away, and they need low fat because of the steatorrhea. Cystic fibrosis, tick, 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 mucus. Whose fault?
Messina.
Mom and dad. Okay, let me finish first. Right?
Okay.
So this is genetic counseling. This is mom and dad guilty. I call that autosomal recessive. So this is the one that need genetic counseling. Yes. What's your question?
I believe there was a med called like pancreolipase.
That's the one.
Yeah, would you give that to decrease steatorrhea?
Yeah, that's what I say just now.
Oh, okay, sorry, I wasn't here.
Yeah.
Miss, I had a question. It was about the vitamin A, D, E, K. Did you say that they should take it or they shouldn't take it?
They have to take it because it's a vitamin that fat soluble.
Okay.
So every time I give them fat, they throw away all gone with the poop. So that's why they lack of this vitamin. So you need to help them with this vitamin.
Okay.
A, D, E, K. Yeah.
A, D, E, K.
Mm-hmm.
Thank you.
That's your fat soluble. That's why if I give you vitamin A, D, E, K, is that possible you're toxic? Can you become toxic by vitamin ADEC, A, D, E, K?
Yes.
Yes, because it's fat soluble. But if I give you vitamin B and vitamin C, you will not toxic, you just pee it out. And then your urine will be orange color.
Okay. Thank you.
Yeah. Any other question? Okay, and whatever that you learn, don't forget, okay? Keep it until you, in classes, you need all of this, okay? And even until RN. I have many student RN, they still come back to tutoring. All right, and it will help you to pass your RN also in class.
For the RN, is it the same pharmacology or they have like more books and it's in more details?
Basically almost the same, whatever that you learn. It's more critical thinking for RN. That's why if you possible, if there is open door, continuous, go get it. So you don't wasting your time. But it's good also to work like at least 1 to 2 years on the floor, so you know you have experience as an LVN. Because it will be tough one day if you suddenly RN and become a supervisor, but you don't know the job of LVN. That will be tough. And then when your LVN call off, you freak out because you don't know what to do. So that's not a good thing. At least 1 to 2 year experience will be better. Okay, so please don't forget cystic fibrosis. Tick, 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 mucus everywhere. Can you remember that? I hope you have hallucination tonight. Okay. Even though I don't go with you to term 4. Okay. But please always come to my tutoring so it can help you for your exit.
Thank you, Miss Ina.
You're welcome. So let me just go to the one that important, okay? So this is your antiplatelet. Remember your aspirin. Remember COX. That's your celecoxib, right? Celecoxib. That's your antiplatelet. Also clopidogrel clavic. Try to memorize this because this is very common name, right? Your ticlit. So those are my antiplatelet. Like when somebody had attack, Mona, morphine, O2, nitro, aspirin. Why you give aspirin? Because antiplatelet. Don't say analgesic. My analgesic is the morphine because it's heart attack, so the pain is severe, right? But the reason I give you aspirin here, not as analgesic, it's antiplatelet, right? So if I have somebody with stent, I will also give them aspirin forever in their life. So I don't want any clot finally at the stent area. But all this medication, be careful bleeding. Always monitor their gum, monitor their sputum, their urine, right? I don't want any bleeding, petechiae, ecchymosis, purpura. And this is the one that aspirin, usually we don't give it to children except rheumatoid arthritis, rheumatoid heart failure. No, this is the rheumatic heart fever, Kawasaki, right? And then the juvenile rheumatoid arthritis, because there is rheumatic, so it's the joint. So joint problem, it's good for NSAID, use NSAID. But I want to make sure when I give it, there is no viral infection to prevent Reyes syndrome. Any question for that? Okay, so no that one. And your MONA, right? Everybody have to know your MONA, morphine, O2, nitro, and aspirin. I see one test question. Okay, I give morphine, but what should I check, monitor? Respiratory failure. I don't want respiratory failure because then they will need naloxone, right? That's mandatory. You have to know naloxone, and the pain will come back. Anticoagulant. This one, no bargaining. Okay. So if you see this question, I do not want to see anybody make mistake. Heparin, subcute IV, careful, I can kill somebody with heparin, always double check to licensed nurse. This is your anticoagulant, high alert. Antidote is protamine sulfate. If I give you too much, right? Memorize your PTT. And then I have Coumadin, that's your anticoagulant PO per oral. Antidote is vitamin K, pitonadione, aquamefiton. Don't eat a lot of green leafy vegetables because green leafy vegetables have a lot of vitamin K, so it will neutralize your coumadin and not working. Okay, so you have to avoid green leafy vegetables. And for coumadin, I have to check your PT and INR, right? PT is 10 to 12 seconds, and then INR is 2 to 3. Okay, so no bargaining with this one. This one everybody have to know. This is different type of clotting factor, and final result is the fibrin, is the clot, because you step on something and then automatic they will have to work together to make it clot so it can stop the bleeding. And why we have so many medication? Because they work in different factor, right? They have number. When you go to RN, they need you to remember those, what number, what clotting factor that they affect, right? For now, you don't need to. So you have Fonda, Parinox, you have the Dabigatran, Argatroban, right? Your Xarelto will be among here. Xarelto.
No. Ms. Zena, I have a question.
Yeah.
What is Kawasaki? What is that?
Kawasaki is the a children disease, right? And in their heart, outside the heart, they find a lot of aneurysm. So earlier I write it for you. There is a lot of aneurysm. Aneurysm means the blood vessel bulging, right?
Okay.
And it's a lot in the coronary artery.
Okay.
And then they also, the palm will desquamation, means the skin peel off. So we are very surprised when COVID start in New York. Suddenly there is a lot of Kawasaki. So we almost think maybe COVID caused Kawasaki, but they say after research they cannot really connect. They cannot really connect. They cannot really prove that COVID can cause Kawasaki, but they can tell why so many children have Kawasaki during that time.
So aspirin is used to treat Kawasaki. It's not caused by aspirin. Okay.
No. And the reason why I need aspirin for Kawasaki, because they have all this aneurysm, so I don't want it burst. So I want the blood just thin.
So it's kind of like a prophylactic treatment for it?
Yeah.
Okay.
Okay. And they don't really know what caused this Kawasaki, maybe toxin of something, because sometimes without do anything, they heal by themselves. Okay. So it's weird. And I use all this medication, the one that uh, try to dissolve the thrombus, right? That's why I can use for stroke because there is a clot here. Heart attack also there is clot there, and deep vein thrombosis, right? That's a clot that finally flow with the blood and go to the blood vessel in the heart, go to the blood vessel in the brain, and that's how they got heart attack and stroke. So anticoagulant, first line against blood clot. And I want you to remember that heparin cannot dissolve. Okay, let me write for you. Your heparin, anticoagulant, right? Anticoagulant. Your aspirin, antiplatelet. Remember when I tell Teresa to stand in the front with your friend, right? And I say one is the platelet, one is the coagulant, right? Or I say something else. But if I say anticoagulant, that means I don't want the whole class. But if I say I don't want antiplatelet, means I only one person platelet, I don't want that. So that's the difference. All right. What I tried to say earlier that you need to know. Heparin, antiplatelet, okay, anticoagulant. Okay, this is what I want to say. This heparin is not the same with thrombolytic, right? Thrombolytic. Again, from the word, it's so easy. Thrombolytic means I lysis your thrombus, I dissolve, right? So I lysis your thrombus. Lysis is dissolve your blood clot. Your heparin is not thrombolytic because your heparin cannot lysis the thrombus. Your heparin only can stop, prevent clot. I prevent the new clot. Okay, so your heparin is not thrombolytic. Your thrombolytic is your thrombokinase, alteplase, right? TPA, that's your thrombolytic. Because they can dissolve, means the clot is already there. What should I do? The clot is already there, right? Your answer is not heparin because heparin cannot dissolve the clot. The one that can dissolve is thrombolytic. But why you give heparin? Because I prevent the new clot. I don't want more clot. Okay? And this is for lipid, but let me tell you what you have to memorize for tonight, right? You have to know everything about this, right? I don't want any complaint about muscle because it can cause rhabdomyolysis. Myo is muscle, rhabdo at the abdomen, lysis is dissolved. Don't give it with grapefruit, especially Mevacor, Zocor, Lipitor. That's your lofostatin. So go find the generic what tristatin. Give it at night, right? One time only at night, give it at night. And then liver, careful, monitor SGPT, SGOT, ALT, AST because statin can damage the liver. And usually I just also want to make sure that their kidney function well because I need to throw away the waste product through kidney. Okay, and this is your anti-cholesterol, anti-lipid, statin, 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 statin. Know all of this like all the apply. Mandatory, okay? This slide is mandatory for farm. Yeah, later I will post it. Just remind me, sometimes I forget because I have to drive home like 1 hour. Okay, know your lab value, cholesterol, triglyceride, HDL, LDL. For this one, just remember my epogen to make more RBC. So careful with hypertension. Okay, epogen to make RBC, neupogen to make WBC, opralvecin to make more thrombocyte. My epogen is in my kidney, my opralvecin in my liver, so my liver can help me with thrombocyte. My kidney help me with RBC. And my neopogen is in all the lymphatic nodes, spleen, all your lymphatic nodes. That's your lymphatic system helping with the white blood cell. Okay, don't forget hypertension, it will not hypo. Cardiac medication. So your olol beta blocker, those are your cardiac. Let's just show you. Okay, know this one, diuretic, right? Furosemide, hydrochlorothiazide, you will throw away your potassium. So careful hypokalemia. Give them diet potassium. But be careful, your spironolactone, aldactone, your triamterene, amiloride, the opposite. They are potassium sparing. So careful, this one is hyperkalemia. Okay, hyperkalemia. Let me ask you, what is your medication for hyperkalemia besides furosemide? Because usually you will tell me right away, furosemide.
Hydrochlorothiazide.
That's number 2. Give me more. Which one that Miss Ina said always in the Inclex? What
The
is your,
thiazide?
say one more time?
Is it the thiazide one?
No, that is already there, hydrochlorothiazide. This one also I want you make sure you remember because this one always in Inclex, right? So I need to give the kayak salad, pretty famous, right? But in Inclex, they will not give you the name kayak salad. They will use this polystyrene sulfonate. Polystyrene sulfonate. It's always in Inclex. Please memorize. Many times the student will come back to me and say, Miss Ina, you are right, but I forget. So I was mad. Don't tell me that. Okay? Polystyrene sulfonate, and usually I also will give it together with insulin and D5W dextrose 5% in water. And then they will ask you how it works. This one will bind potassium and then it will throw it to the stool. So your patient will have diarrhea. But don't tell me that this is a stool softener. No, it's not. The reason why I give you polystyrene sulfonate, sometimes they call this resin, right? Resin. To bind your potassium because you have too much potassium in your blood.
Christina, why do you give it with dextrose or insulin?
I'm not yet go there.
Okay.
That's my next one. Okay, so the polystyrene sulfonate resin to bind the potassium and throw it to the stool. And the insulin, remember I told you insulin is the bus, it's transportation, right? So for the sugar and also for potassium, for me to be able to go back to the cell, I need the transportation, right? So your insulin and also your sugar, D5W, the water, right? The sugar and insulin will together help your potassium go back to the cell. Potassium go back to the cell. Remember, your potassium house, they have to stay inside the house. That's potassium. Potassium is your intracellular. Cation. Cation means positive. It should be the correct place is inside the house. They can play outside only 3.5 to 5. That's it. They cannot too low, they cannot too high there because if too low or too high, they can have cardiac problem. Okay, so I have to stop, but I will post it right now. Make sure you read